Hello, friends. I hope everyone is doing well today. So, today I am going to be talking about.
Nourish your pup and the
Oh, let me mute my mic real quick. I want to have the chat open. Okay, I want to have the chat open. So, when I'm on YouTube on my other screen, it starts playing an ad. So, today I'm going to be sharing my scary hospital experience. I didn't really want to do this. It's very nerve wracking for me. And I kind of would just have liked to move on from the whole situation. But I was recently on a panel with Nurse Liz, and this was her topic. And I shared a little bit about my story. And I think it's important to bring awareness to it. So I just want to say I'm on my channel, I'm usually very pro nurse, and I am the first one to advocate for how understaffed that we are. So I'm very pro nurse. This video is going to be from the patient's perspective. So, um, and it was very scary. And I just hope that it also, if you've had a bad hospital experience, drop a comment in the chat and let me know what you've gone through. I hope that this isn't the new norm, but it was very alarming. So I went to the hospital back in May. I was having the weirdest symptoms. I was having tachycardia. I was short of breath. My arms were tingling. I was having paresthesia. And I just felt like my extremities weren't working correctly. Like I was having like muscle weakness. It was very bizarre. Oh, you're welcome. I'm glad that you passed the CPR. Congrats. So, of course, as being in healthcare, I go to the hospital as a last resort because I know that the hospital can be a dangerous place. I know that the hospital is understaffed and overworked. I'm not one of those people that's just going to the hospital because I feel like it, right? So, um, I went to the hospital because I felt so sick. And I drove myself because my husband was working. I went to a hospital that was closest to me instead of going to a different hospital. I live in Central Florida. There's a hospital called Celebration. It has a better reputation. But I was like, I don't think I can make it to Celebration. So I am just going to go to the closest hospital. I actually used to work at this hospital where I drove to. Driving myself to the hospital wasn't the smartest idea. As I'm driving there, I'm literally like praying to God, like, God, please let me make it. Please let me make it. I was just feeling flushed and tachycardic, and I felt like I was going to pass out. It was very dangerous, not safe. When I got there, the parking lot was packed. I couldn't even park in the ED. I had to park in the offices surround, like the outpatient offices, and walk myself to the ED. And again, this whole time I feel like I'm going to pass out. When I finally the whole check-in process was okay. I have no issues with the triage nurse. I have no issues with the check-in nurse. That was okay. My issue was when I finally got in a stretcher and I'm in the room, the tech comes in, the nurse doesn't come in. I don't see the nurse for a while. So tech comes in, introduces himself. He was nice. I'm in the stretcher. I have no idea where the call light is. And before this, I'll tell you later what I had. I want to kind of save it for the end. If you've been following my channel, you'll know what I had. But um, all of a sudden, like I just start getting, I'm laying down. My resting heart rate is normally in the 60s. And it felt like a wave of heat. I'm connected to the monitor, so I can hear the monitor start beeping. I feel a wave of like heat go up my body. My muscles start to contract. My legs get stiff. And I can hear the monitor like beep, 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 like that. And basically, the monitor is saying, like, something is abnormal, a vital sign is abnormal. And just from how I felt, I knew my heart rate was through the roof. So I I've never heard of this happening to anybody else with this specific what I had. So, when I tell you what I had, let me know if you felt it, but this is not typical at all. I'm kind of trying to look back to see what the monitor is saying. And I see the monitor, my heart rate climbing. It goes like, I was tacky to begin with. So I was like 110s, then I go to 120, 130, 140, 150, right? And I just feel like I felt like this is it. Like this is how I die. No one came in the room. The monitor's going off. I don't know if they have a monitor tech in the ED. We have a monitor tech on the floor. I'm in the 150s and I literally feel like I'm going to die. Like, this is it, right? So I'm in the 150s. I don't have a call light next to me to call the nurse, which is like, that's like nursing 101. Like, always have the call light by your patient. That's like nursing 101. So there's no call light. So what do I have to do? I have to start calling for help. But I don't want to scream because my heart rate's already fast. So I'm just like, help. I was like, help, help, like just trying to get somebody's attention. The first thing that I hear people outside my door talking, whatever. The first thing I hear is, Ugh, who's calling? Oh, it's room 4, right? Like, it's like, oh, I'm sorry to inconvenience your discussion, your chatter. And if I had a call light, I would have rang it, but I don't have a call light. So I have to call help, right? That was my first issue, right? How dare you be like, ugh, who's calling loud enough for me to be able to hear, right? So, as nurses, be very cognizant about what you're saying and the fact that patients can hear, right? I'm calling and I'm like, I need her in here. Like, I'm going to die. I need medication to slow my heart rate. So I'm calling for help. I'm calling for help. Finally, she comes. She's like, yes, what? What's going on? And I was like, please, I don't like telling people that I'm a nurse. I didn't even tell them I was a nurse practitioner. I don't like throwing that out there because I want people to treat me like if I don't know anything. But I was like, please, I'm a nurse. Something is going on. I was like, I don't feel well. I need medication for my heart, please. So she's like, well, we have to wait for the doctor to come in and whatever, whatever. So you know how I was telling you, like my muscles got stiff and I couldn't really move. I'm going through like differentials in my head. And I felt it was weird. Like, my muscles contracted. My arm was in Trousseau sign. And then finally the wave kind of like went away and I started to get like movement again in my extremities. So at that point in time, I called my husband and I was like, you need to come here. You need to come here right now. I was like, something is happening to me. I don't know what's going on. I I don't feel well. They're not taking me seriously. And I need you to come advocate for me in case I pass out and in case I can't make my own decisions. And I'm telling you, I felt so bad. I told him, I was like, I don't want extraordinary measures, like, just the basics, right? I don't want extraordinary measures. Like, I don't know what's going on, but you need to get here. He was 2 hours away. So he leaves his job. He starts coming to go see me. The doctor comes in. The ED doctor was very nice. Um, but I just felt like nobody was taking me seriously. Um, she she came in, she's like, "What's going on?" I was like, "My heart rate's just going, like, I'm laying here and it's just going up. I need something for my heart rate." When she was in the room, I had gone back down. So she's like, "Okay, well, I'll put some orders in and we'll leave." Now, keep in mind, she was very nice, but I had told them I have a history of asthma and I have a history of Sjogren's. Provided them with the medications that I take, and they ended up prescribing propranolol, which, if you're in healthcare, you know that propranolol is a non-cardioselective beta blocker, which means it could potentially cause bronchoconstriction and make my asthma worse and potentially not be able to breathe, but whatever. At that point, I wasn't worried about that. I just wanted medication. So so I'm laying there, the kind of wave had left. This wave goes again. Again, I'm going through the 110s, 120, 130s. My muscles are contracting again. I can't move. Um, when the nurse came in the first time, she had put the call light next to me. So I hit the call light and I was like, please, I like the so the call light has like the hook can speak. I was like, please, I need the nurse to bring me the medication. Nurse never came. My husband was 2 hours away. He gets he gets to the hospital. I still haven't got my medication, right? I felt like, so initially with the first 150s, I started going into SVT, which is supraventricular tachycardia. What if it had progressed to like a life-threatening rhythm? What if I had gone into VTAC, right? Are we going, like, as a nurse, I was never reactive. I was proactive. Of course, things are going to happen, but if you see a patient is declining, if you see a patient's heart rate is climbing, why do you not medicate them and prevent a potential code or deadly lethal arrhythmia? Like, why are you just letting it sit back and say, we'll see what happens, right? Um, she could not have cared any less. Like, she could not have cared any less. She was not empathic. She was aloof. I can't tell you like how bad of a nurse she was. And if you are working in the ED and you're at this point, I don't know if she was burned out. I don't know if you're overworked, right? But if you're at this point, you need to get out of the ED. You need to get out of nursing and maybe or get out. I don't mean like get out of the nursing profession, find a different floor, find a different unit, do something else. But if this is how you're treating your patients, then that's not appropriate, right? So now I'm in the 130, so I'm in sinus tachycardia. It's not like the first time where I called my husband, but I still haven't got my medication. When my husband comes, I'm in the middle of another like wave where I'm like contracted and I can't move. And he comes in, he's like, "All right, have you what's happened?" I was like, "Nothing." Like literally no one has given me any medication for my heart rate. Like I'm just sitting here left to suffer. And it's not like I was asking for benzos. It's not like I was asking for morphine or Dilaudid. Like I'm just asking for medication to slow my heart rate so I don't stroke out here, so I don't have a heart attack, basically, or cardiac arrest would be more appropriate in this scenario because my heart is beating so fast. So he's like, okay, who's your nurse? I literally have to tell him like, she's right there. Like I can't get out the bed. I'm connected to all these things. And he has to go talk to her, say, hey, can you please bring her medication? Like 2 hours have passed, if not more, I think around 3 hours, because I was in the room for at least an hour before, he was able to get to me, and he was 2 hours away. So it took about 3 hours before she finally brought the medication. So that to me was like ridiculous. Later, I will find out that my potassium was slightly low. The potassium was not the issue. Like my potassium was not low enough to be causing this crazy arrhythmia. But she charted that she replaced my potassium and she never did. So that's forgery. That's falsification of records, right? How do you chart you give a medication and you never gave it? The nurse on the floor was like, "Oh yeah, well your potassium was a little low in the ED, so they replaced it." I was like, no, she didn't. Like, I never got potassium. And trust me, again, I'm in healthcare. I know, like, I never got an IV bag that had potassium. I never got a pill. The only thing I got was a propranolol. And I never got that little powder that it comes in and they mix it with orange juice, like nothing. So I couldn't believe that. That was the ED scenario. Next, I go to, oh, the attending. That's the other thing. The attending that came to see me. So what hospital were you at? That is a precarious situation because I I can't I don't know. I would like to say, but it could potentially put my employment in danger. So I don't want to say. But it was in Kissimmee in Florida. So the attending comes in. He's a young guy, has okay, some, not all physicians are like this. There's some phenomenal physicians. The attending comes in, what's going on? And at this point, my husband is there and I'm contracted again and I can't move. And then he's like, I was like, I don't know. The only thing that I could think of, I start running through differentials in my mind is like, what's different? What is different that could be potentially making me sick? And the only thing I could think of is like about a month ago, I have really bad TMJ and I had Botox injections for TMJ. I was like, I don't know. I was like, the only thing I can think of is am I like, is my, I have thyroid nodules too. I was like, is my thyroid like reacting to the Botox, whatever? And my husband asked the attending, and also be cognizant of your body language. Like he comes in like, just again, like I don't care about you. And my husband asked, like, have you done any blood cultures? Because my husband's always also a nurse. And he's like, no, why? Like, why am I going to do blood cultures? Her WBCs are fine. And I'm immunosuppressed. I take a pill to suppress my immune system because I have Sjogren's. So my white blood cells aren't going to always show infection. I don't have fevers. Like, I rarely will have a fever because, again, I suppress, my immune system is suppressed. So blood cultures wouldn't have been that out of the ordinary to consider, why am I contracting? Right. So he's like, have you had a fever? I was like, no, but I never really have a fever. And then he's like, well, I'm like, basically, he was treating me like a cardiac patient, but I wasn't a cardiac patient. Something is making my heart beat this fast. I was like, well, like, I was like, I don't know. Can you like maybe consult endocrinology to see if my thought? No. Like, he was not listening to me. Could not have cared less. Whatever. Um, and then the other huge thing that was a huge medical error when I got to the floor. Well, first of all, when I got to the floor, um, so someone wrote, I'm a nurse, so I know exactly what you mean. There are a lot of nurses nowadays don't take their job seriously. I have COVID, POTS too. How is your heart rate? Do you have to take meds? So, um, I'm 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 glad that you're not one of those nurses, hep side. So again, this is what broke my heart because when I was a nurse, I'm not saying every person has to be extremely compassionate or empathic, but at least fake it while you're on the job, right? I'm okay with, people make those memes and we all laugh and joke and we make like some really messed up memes sometimes. But when you're on the job, like that's the time for you to really care about your patient because the thing that's different about nursing is you have patients' lives in your hands. So you can't just half ASS it, right? If you do, you could be potentially killing someone. So, so I get on the unit and now they had drawn my my labs from my IV site in the ED, but maybe it's a fresh line and it came back normal, right? But the nurse on the unit, and this is later, like I'm skipping back and forth. It's part of my ADHD. I'm skipping all over the place with this story. But this was the other thing that was like very alarming to me. So when I was on the floor, she comes to draw labs from my line. And I said, hey, I would really prefer if you stuck me because it's more accurate. And I mean, who wants to get stuck? Like, I don't want to get stuck, but I just wanted my labs to be accurate. So she's like, it's fine. No, it's fine. And she was nice, but nice doesn't always mean competent. So she's like, no, it's fine. I'll waste some syringes. And what we mean by wasting syringes, so exactly, MDs are too quick to dismiss any input from someone who isn't a physician. Or I mean, like, I don't know. Like, yeah, we need to listen to our patients. And I don't know. I feel like I've had better experiences with DOs and NPs listening than MDs. But anyways, so she drew my labs from the line. She said she was going to waste syringes. She did waste blood from the syringes. And she comes back about an hour later and she's like, oh my gosh. She's like, your potassium is critical. Your calcium is low. We got to replace your potassium like right now. I don't even know like how low it was that she was freaking out so bad. And I was like, do me a favor. And by this time, I finally like I was asking for propranolol. I think they had ordered it like Q6. I don't know if it's Q6 or Q8, but I was taking it around the clock because it was the only thing that would make me feel like my heart rate wasn't just gonna go to the 200s. So I was like, do me a favor. I was like, just draw my labs again, take them from the vein, and if it comes back critical, then I will let you infuse potassium in me. And for those of you that aren't in healthcare, potassium is has a I will say like has a very narrow therapeutic range, right? So potassium 3.5 to 5. If your potassium is too low, you can get arrhythmias and you could potentially again have cardiac arrest. If it's too high, also you could have arrhythmias and potentially cardiac arrest. And in fact, I've known patients, he wasn't my patient, but he was very stubborn. And on a day that I was not there, he refused to take his Kayexalate. Um, he would refuse it all the time. And he would refuse any measures to lower his potassium. And he ended up passing away because his potassium was too high. So potassium being too high is a very real concern. And I knew in the back of my mind, I was like, if she just starts flooding me with potassium, she could potentially kill me. So she draws my labs again. At least she listened. At least this nurse listened and didn't dismiss me. So she draws my labs again and they come back normal. And she came in and she even apologized. And she's like, I'm so sorry. She's like, this has been a learning experience for me. She's like, I'm a new nurse. I've been a nurse. I can't remember. She said like a year, but she said she was a new nurse. She's like, I I could have potentially given you too much potassium. And in my head, I'm like, I didn't want to make her feel worse. But in my head, I was like, I know, like this could have been serious. Right. In the meantime, um, the attending is refusing. He consults cardiology. Cardiology comes to see me. They did a 2D echo. Cardiology says that from his standpoint, everything looked fine. He was an MD, but oh, he was lovely. Such a sweetheart, so kind, listening to me. And he's like, you're fine cardiac wise. He said, he's like, you have some infection, something is going on in your body that is making your body react this way. When I tell you I couldn't get to the bathroom without being short of breath or tacky, like it was awful. Here I am for someone that's super active. I work out all the time. And all of a sudden, I can't walk to a bathroom. And the attending comes in the morning. He's like, once cardiac clears you, we're letting you go. And I was like, he didn't want to keep me even from the ED. And I was like, you can't just discharge me. I'm like, you don't even know what's going on. I'm like, what if I go into SVT at home? Like, and I'm just like begging. I'm like begging. Now, first of all, why am I begging for care when I'm the one that has to foot the bill, right? Hospitals are expensive. I was insured. At that time I had overlapping health insurance. I was insured by my husband's insurance and by my own insurance. And you're treating me like like I'm like I'm not a paying patient? Like how dare you treat me like this? So, when he came back in and I was like, "Can you please at least do like a thyroid ultrasound?" I was just asking for a thyroid ultrasound. Like, "Can you please do a thyroid ultrasound like to see if like my thyroid nodules are bigger? Like am I in thyrotoxicosis? Can you do some thyroid labs?" All he did was a TSH, which it came back abnormal. My TSH came back abnormal and he still didn't want to consult endocrinology. The nurse was in there while I was with the physician. My husband is there, and me and the physician are just going at it. Like when I was younger, hi, Oliver. When I was younger, I was, my parents, I was raised to be like the good girl. They were so strict. Don't, like just stay in a corner, be quiet, do as you're told, right? But as I've gotten older, like I advocate for myself and I was not having it. I was respectful, but I was firm. And I don't know, he was Hispanic. Not all Hispanics are machista. I'm Hispanic. I know that in general, males tend to be very machistas. Sometimes it's still there. Um, yeah. So he's saying, like, wonder if there was some profiling taking place, assumptions made, right? So he's not listening to me. He's not backing down. So I was like, okay, I'm done. Like, I'm done. So he walks out of the room. I tell the nurse, I was like, I want to speak to the charge nurse. And I never thought I would have to do that. I never thought I'm not the kind of person that's like, I want to speak to your manager. That's not me at all. But I told the nurse, I was like, he's not listening to me. I need to get some answers. I want to speak to the charge nurse. The charge nurse never came. I told you I've worked at this hospital. I not on this floor, but the difference, like when I worked there, my manager was on top of it and she instilled in us like every patient is your patient. We would have to do like what we call like the 5 Ps and hourly rounding and check on our patients. Like I was never this kind of person. But anyways, so I want to speak to charge nurse. Charge nurse never came. But I told her, I was like, I want to speak to the charge nurse about getting a new doctor. When the doctor came back in, I don't know if that hurts. So the other thing that people don't know about hospitals is if they discharge you, if the quicker they discharge you, the better for their metrics. it just goes to show like they're not keeping people there as long. So I just felt like I was a number to him and he wanted to get me out as soon as possible. Didn't care. He did not care. But whatever, he's a physician, I'm a nurse. I can't speak to them. I don't know what their situation is or whatever. I'm not going to focus on the physician at that point. But when he came back in, he was completely different. His whole demeanor changed. He was like, I heard that you wanted to get a new doctor. Is there anything that I can do? I I was like, I just feel like you don't like me. And I flat out told him, I was like, I just feel like you don't like me. And sometimes by addressing the elephant in the room, like that completely disarmed him. And he kind of relaxed. And the other thing that I did is he spoke, his English wasn't awful, but I could tell that he spoke Spanish better. So I just started talking to him in Spanish and his whole demeanor changed. And I just was like, maybe if I can connect to him as like a Hispanic, and it shouldn't be like that, right? You shouldn't just treat people better versus like it, whatever. But as soon as I started speaking to him in Spanish, I was like, I really don't feel well. I'm very active in normal life. Can you please just get endocrinology? He's like, okay, I'll consult endocrinology. That was all I wanted. I wanted to make sure I didn't go home and stroke out because my thyroid was going out of whack, you know? So, I had even taken paperwork to the hospital showing that I had thyroid nodules, and even before that, he didn't wanna order that. I wrote some nurses here, some notes here, so I'm just checking to see, what else I wrote. Oh, and then after shift change, the other nurse, which by the way, they never did, we're supposed to do as nurses now, we're supposed to do report at the bedside. They never did that. And at shift change, another nurse brought me potassium again. She was like, "Oh, your potassium's low. We need to replace it." I was like, did you check the most recent labs? Because my most recent labs came back as my potassium is normal." And she's like, "Oh, okay, let me go check." So that's twice that they tried to replace my potassium when my potassium was normal. And the other thing is a diet was never put in when I got to the hospital. When I was a nurse and I was getting a new admission, I would get a bucket ready. I would take it to the patient's room. I would be calling the doctor to get a diet order like, "Hey, is this patient going to be NPO or can we start them on a diet solid regular diet?" right? So be proactive as a nurse. That is my takeaway too. Be proactive and please don't take it out on the patient. It's not the patient's fault that you are short staffed. It's not the patient's fault that you're overworked. Do what you need to do on your days off, but do not take it out on us. Like, don't treat us this way. And I pray to God I don't have to go back to the hospital because, and I won't be going back to that hospital. I refuse to. Um, but so I was basically had nothing to eat. There was no diet order put in. Finally, on the second day, I tell the nurse, like, "Hey, there's no diet order. Can you please call the physician to get a diet order?" I don't get a tray so I didn't get a tray for breakfast or lunch. Finally at dinner, I get a dinner tray. But that's also when the discharge. So a lot of things that nurses will do is they'll hold the discharge until their end of the shift so that they don't get a new admission. So she held the discharge. And by the way, she like, again, she was nice when she would come in my room, but do you think she checked in on me? Like, what do you need? No, nothing. Right. So, thank God my husband was there because he could get me stuff, do stuff for me. Um, so she held the discharge until the end of shift. She didn't even do the discharge. I felt bad for the nurse coming in because she didn't, at least if, like, even if she's going to hold the discharge, at least discharge the patient. But no, she didn't. She just left, didn't say bye, didn't do shift report at the bedside, which again was a must on our unit. So dinner finally comes as the night shift nurse is like coming to discharge me. She's like, "Oh, hey, I got your discharge paperwork ready." Um, and I left, right? The next day that I left, the hospital, I woke up with a sore throat, right? And I was like, my sore throat. I was like, I wonder if this is COVID, right? I had already had COVID in December, but I was like, you know what? Let me take a COVID test. So I left the hospital, no diagnosis, never figured out what was going on with me. Um, Doctor didn't seem to care about figuring it out. I should say physician, but because that's my pet peeve too, that doctors do not have a monopoly on the title doctor. That's another video I would like to do. That why is it that they want nurse practitioners that have a doctorate to say hi, not to use that title? So that's another thing. I feel like physicians should also, if they want nurse practitioners to say, hi, I'm Dr. So and so, a nurse practitioner, they should be like, hi, I'm Dr. So and so, a physician. So the physician never figured out what's wrong with me, discharges me. I take a COVID the next day, and it was COVID. So what I ended up developing POTS, which is postural orthostatic tachycardia syndrome from POTS. Never have I heard anybody get muscle contractures like to the point where like they're freeze. It felt, well, it wasn't like it was weird. It was, I had like spastic contractures. And for following weeks, I would have like neuropathy pain, like sharp shooting pain going down my arm. And I struggled with my heart rate for a while. It's getting better slowly, but that is my rant for the day. The ED was absolutely awful. They almost let me die because didn't give me medication for like 3 hours. And the attending, again, very like, didn't care, didn't listen to me. And then the nurses on the unit almost gave me potassium when I didn't need it. So, thanks so much for watching, and leave a comment if you have a bad hospital experience. Leave a comment also if there's a topic that you want me to cover. Like, for example, if you're a nursing student, do you want me to cover like what to expect during mental health clinicals, anything like that? Please like, subscribe, and until next time, bye, friends.